In the Black community, I think that mental health isn't always viewed in the most constructive ways. I think some symptoms are viewed or are kind of misconstrued as other things. So with someone suffering from depression, it could be read by maybe their parents or people around them as laziness. Some things could lead to like poor timekeeping. It could just make them seem quite unprofessional as opposed to having an actual illness to deal with. Some things are just, you're overthinking when it comes to anxiety. So instead of seeing them as problems that are diagnosable, they're normally just brushed off as, bad personality traits or sloppy behaviour.
They will assume taking a paracetamol or a pain relief will get rid of that headache. If someone has an infection and they knock on the door of their GP and get a prescription for their infection, and antibiotics say, they know that is going to cure the infection. If someone has a mental health problem, why can't they, or why should we not knock on the same door? Whether it has to do with trust or whether it has to do with misperceptions.
Either don't trust the system, or think the system's not for us, or the church is the best place, or just leave them, it might get better, let's pray and fast.
I also think that even when it is recognised that someone has an illness in the Black community, it's often such a shame that help isn't sought until the point has escalated beyond manageable, whereas things are normally more treatable in their early stages.
My name is Safia Robinson and I have bipolar disorder.
My name is Vivian Isebo. I'm 26 years old and I have a diagnosis of ADHD.
I suffer from bipolar disorder, and which is a mood disorder, which splits between being manic and hypermanic, which is like having lots of energy, being impulsive, doing stupid things, and depression, which basically means that you lack motivation, you can't really do much, you have no mood, suicidal thoughts, things like that. So I have kind of both ends of the spectrum, and I've also experienced psychosis, so I've had lots of different kind of experiences within mental health.
So I started uni in 2011, and in my second year of uni, I experienced sexual assault. And at the time I was in a relationship. So I remember not being able to speak to anyone about it, except for the person I was with at the time. And it was difficult because they took it quite badly as well. There was a lot of kind of blame throwing and, like, what you doing there? This and the other. So that didn't help in itself, and then also not having anyone else to speak to about it, it just felt like I was falling into a hole that was getting deeper and deeper. So I guess I noticed that, I missed lectures anyway, but I noticed I really wasn't going to lectures. Like, I'd have maybe 5 in a week and I was just going to none. I wasn't looking at any of my deadlines. I wasn't checking any of my modules, and there's a difference between kind of not being motivated and just not wanting to be here full stop. And it took me a while to realise that I'd gone past that mark of just being a tired student, and I just really didn't want to go outside. My emotions were all over the place. Like, I either felt absolutely nothing or I felt extremely sad.
And on the Monday, the 27th of January, so it's coming up to the anniversary, on the Monday, I had booked an appointment for the doctor, for the GP, to go and discuss my bipolar and get off the medication, because I knew that wasn't for me. I'm not sleeping, this can't be right. And they were like, yeah, that's just how it works, like your body takes a while to get used to it. But I was like, okay, well, you're telling me it's fine. So again, I wasn't asked, do you have a history of bipolar in your family? Which should have been asked because of that particular drug. If you have bipolar, it raises serotonin too high and triggers a manic episode. Unbeknownst to me, unbeknownst to everybody else, but the doctor should have asked those questions.
I think it was my dyslexia coach who noticed that I wasn't going to any lectures at all. And then when I explained that I had no energy and I had absolutely no motivation to do anything, and I could barely even eat properly, she recommended that I go to the counselling service. So yeah, I went to them and they were really helpful. You fill out a bunch of forms, as you do with everything. And again, referred me to my GP. That process was very slow and not helpful. But then when I went back to uni and told them that after one session the counsellor discharged me, they were worried because I'd missed deadlines. And obviously this is my final year and I was doing pretty well. So they referred me onto a specialist service. So I had the assessment, and again, like, all of it just felt very alien, even though I'm studying psychology, so I've got some kind of understanding of mental health. I wasn't aware that what I was feeling and these quote unquote symptoms were a thing. Like, it wasn't something that, you know, I'm doing because I'm lazy or because I can't be bothered. There's something wrong with my brain right now. So when I had the assessment and they sent me the report, I was just like, huh? Sending me an acronym, like, the hell is that? So yeah, they diagnosed me with PTSD, with depression, which is post-traumatic stress disorder. And it's interesting because when I Googled it, the stuff that was coming up is stuff about soldiers. They didn't have much on sexual assault, to be honest. But I guess reading through the symptoms, I almost couldn't see myself in the words.
The doctor was basically like, take it to hospital. And so I got to hospital and I didn't want to go in, I refused to go in. I was like, I don't want to go into the hospital. Like, why? I could see like all the security. I was hyper aware of everything. I could see the security, I could see like people like looking at me. It ended up me running around outside, running away from security guards, them like dragging me, them like being very violent and physical with me. I was very distressed, as you can imagine. I didn't really understand why I was there. I didn't know anybody, didn't recognize anything. The next day, I'm woken up and taking medication. They refused to tell me what I was taking for like about a week. I was like, I just want to know what I'm taking. They were like, oh, well, you know, ask the doctor. I was like, well, the doctor's not telling me. They're just saying it's medication. And on my on the write-up, it says that I was reluctant to take medication. I wasn't reluctant, I just wanted to know what it was. They were all treating me either like a big scary black man or like a woman who didn't understand, like a hysterical woman. Those were the two like moods that they kind of gave me. They made a big difference, or big fuss over the difference between me and the other patients. So they were saying, you're scaring the patients, you're scaring them, and I was kind of like, it was very confusing the whole time because, as I said before, I'm not a belligerent person. I'm an Aries, so I'm a hothead, but I'm not a belligerent person. And I think it was really like the first thing they kind of did was kind of label me troublemaker, label me kind of, I don't know, insurgent, and I was just trying to leave. I was just trying to go home. I wasn't trying to hurt anybody.
Once I did the sessions, I was able to find my own language to express what I was going through. So even though the label is stated in a certain way, I was able to understand it through my own identity and identify that, you know, I'm not unmotivated because I'm not passionate about what I'm doing or I don't want to be successful. I've gone through something that requires healing, and that's just never been in my vocabulary, that, you know, if you go through something, you need a period to heal.
This could again be my television or my projection, but I do think that there was just a lack of understanding and a lack of kind of empathy for how isolating that would feel, and how you know, you're already in a horrible place, and there's nothing familiar for you, and the ways of communicating are unfamiliar, and the ways of communicating can be like, you know, cold or whatever, and it tends to be based on, you know, they kind of see you as a threat. There was one black nurse who came occasionally, and she was great. She was like, hey, like, I'm here for you. And I was like, oh my God, like someone actually has made a kind of like direct decision to come and speak to me directly and as an equal, and not talk down to me or kind of patronize me, and actually listen to what I was saying, listen to questions that I was saying, hearing me in a way that black people can hear each other, because we're talking through very specific experiences that sometimes you have to feel to understand. I think with racism, kind of like sexism, you can't just kind of theorize it. You have to actually experience it to fully understand the totality of the experience.
My name is Kirsty. I have battled with depression, anxiety, suicidal thoughts, eating disorders, and self-harm.
My name is Jason Chen. I'm 31 years old, and I've been battling with anxiety and depression.
When I was in year 9, so roughly 14 years old, I was involved with an older guy. And at that age, the world is your oyster. You know, you want to impress the people around you. And the only thing I wanted in life at the time was to be liked by this guy. And there was a stage where he was treating me badly, and he actually called me fat. And to a 14-year-old girl, it's like your world falls apart. So I stopped eating. I essentially starved myself for a month, where I wouldn't eat throughout the day and I would eat something small for dinner. And I lost a drastic amount of weight. And that hit me really hard, because you could see it in the pictures and the videos that I took before and after. And I essentially didn't feel good about myself, even though I was slimmer. It didn't make him like me anymore or any less. So really and truly, I damaged myself for no reason whatsoever. And in thinking about that, I then went into depression. I became really isolated in everything that I did. I couldn't speak to my mom, I couldn't speak to my sister. They realized something was wrong with me, but there was nothing they could do. And in that sense, I began to self-harm, usually on my arms, on the inside of my arms. I used to break up razors that you would use to shave your legs. I'd break them up with a hammer and get the blade and cut the inside of my arms. And I did that for quite a while, until my sister caught me and called my mum. And at this time, my parents had broken up, so my mum wasn't living with me. So I got a phone call from my mum, and she was crying down the phone to me, and she was asking me why I would do this to her, and do I not like living, and why I would put her through something like this. It was very hard for me, because I couldn't express how I was feeling to her, because I knew the first thing she would say is, so you're doing this over a boy. So I kind of played it off as in school was too hard and I don't know how to handle it.
I got a phone call from my sister. It was a normal day for me, just being the cheeky person that I am, whatever it is that I was doing. I just know I was in a good mood because I was different back then. And then I got a phone call and she's like, Jason, you need to take mum to the hospital. And I was just like, oh, can't be that serious. She was in Jamaica for a couple of weeks before, enjoying herself. I was looking at pictures, just having fun. I was like, it's probably something trivial. She was like, Jason, you need to take her. And she kept persisting and persisting. And I was just like, okay, I'll go with her. So I haven't seen my mum for about 2 weeks because she was away. But when I saw her, I just knew something was different. Just from looking at her physically. She was very underweight, like to a point where it was a bit alarming. So then we went to the hospital now. She did all these tests and I just thought it was a bit abnormal to do all these tests for a general checkup. It just didn't make sense to me. Then the doctor called her in after all these tests and then I insisted to go in, but my mum wanted me to wait outside, but I wouldn't take no for an answer because something in my spirit was saying something is wrong. He then said, what do you think it is? And I remember my mum, she doesn't play games. Lorna Jackson does not play games. So she was like, just tell me, give it to me straight. He said it's either one of two things. It could be tuberculosis or lung cancer. And as soon as I heard lung cancer, I knew it was lung cancer. I knew. And I think she knew as well, because in that moment she looked at me and she just whispered over, oh, it's gonna be okay. To cut a long story short, we were walking home afterwards and we're going the route that we usually do take, you know, after we go to the gym together, because we used to do that, where we get our patties and our bun and cheese, and she couldn't walk properly and she kept stopping, taking deep breaths, and then she was bleeding through her mouth. And the irony is that the doctor said it was one or two things, but the bleeding through the mouth is known to be a symptom of lung cancer.
After going through this questionnaire with my doctor, she diagnosed me with depression. And she said, I'm going to refer you to a counsellor at CAMH. So the counsellor was due to see me in school on a weekly basis. And when that began, things started to look up a bit. It was nice to talk to someone that I didn't know, because then I felt like I wasn't being judged. And then things started to go downhill again, because that same guy began being horrible to me. And the things he said to me, I don't really know if I'm allowed to disclose, but I'm gonna say it anyway. Things like indirectly calling me a prostitute. I remember one time he got angry at me for no reason, and he told me to go stand on the corner of the street and he was gonna send his dad and his brother to have a turn, and then he was gonna have a turn. Things like that, and I could never understand why, because I never did anything wrong.
A few days went, and then the doctor said, look, this is growing and it's spreading, so we're gonna have to operate, we're gonna have to put a stent, you know, where the tumor's growing, and hopefully that will, you know, create more space within her lungs and it will help the situation a bit more. So we did that, that didn't work. Fast forward a bit more, the doctor said, we're gonna have to do chemotherapy, but if we don't do chemotherapy, she's gonna die. And if we do chemotherapy, you know how the story goes. So she done chemotherapy. We decided that it's best that she does chemotherapy. It's the lesser of two evils. If we can prolong her life even by a fraction, then that's essentially what that matters. And I remember the last conversation I had with her. It was like a 10-hour conversation, because the chemo was taking a very long time, between 10 to 15 hours, and I didn't leave her bedside. You know, I was cleaning her, feeding her, washing her. You know, she wanted to move. She would call for me like, where's my son? If the nurse was gonna come and lift her or move her somewhere else, she refused. She said, I want my son to do it. I could be downstairs in the hospital, I'll get a phone call, your mum wants you to move her. That's the kind of relationship that we had. And we were talking for hours and hours and hours. And she said to me, Jason, I know that I'm not gonna make it, but you have to keep going, you have to stay strong. She knew, and I knew as well.
When I got to year 11, it was the GCSE season, and one of my friends that I've known since I was 3 years old committed suicide. And that hit me really hard because I didn't know she was battling depression or suicidal thoughts. And I never knew why she did what she did. And I think that one was really personal to me because it makes you realize how easy it is to take your own life. And I think that impacted me a lot because if she could do it, I could do it.
And then I went to work, I was working on set. And the one day that I wasn't gonna go visit her, my sister calls me, and I remember like it was yesterday. And she calls me, she's like, "You right?" And I was like, "I'm fine, I'm good." I said, "How's mum, how's things?" And she said, "Mum's dead." And I just had to walk away from the set and process that. And then I had to take that long journey back from where I was, because I was working out of London at the time, just so I can see her body. But when you lose a loved one, you don't really know what's gonna happen to you. You kind of go into flight mode and you just plan the funeral and do what you need to do. And that's what I did. And I went back to work, and life continues too fast when you lose someone, and you just have to stay on that train.
I went through a situation where a guy I had been dating previously when I was in secondary school was now my friend, I should say. And I still had feelings for him, and we planned to discuss our current feelings for each other. So I went to his house as usual. I'd known this guy for years. We were really good friends. I went to his house and he urged me to go up to his bedroom with him so we could talk in private. His parents weren't at home. And we sat down on the bed and he began to tell me, you know, he likes me, but it's not the right time. So we left it at that. And then he got on top of me and he started to kiss me. And I told him that I didn't want to do anything with him, especially when we weren't going to progress things any further. And he continued to kiss me and tell me everything was gonna be okay. And I tried to get up, and then he pinned me down. And I continued to tell him, I don't want this. I don't want to do anything with you. And then he just continued, and he put his hands down my trousers and inserted his fingers inside me. And I continued to tell him, no, stop. And I began to cry. And then he took out his penis and put my hand on it. And at that point, I froze. And to relive something like that for every day of your life, you feel worthless. Lucky for me, at that point, he stopped. But things could have been so much worse. And every time I think about it, I just want to cry. I just want to die inside, because you think to yourself, what did I do to deserve this? Was it something I was wearing? Did I say something? did I insinuate that I wanted to do something even though I told him no? Were my actions different to what I was saying?
And it was only probably a year after her death when I realized that something was wrong and I wasn't well. I noticed my behavior was different. I was more aggressive. I was angry. And I just didn't even have the will to live. You know, you want to be somewhere else. And I used to think, what is somewhere else? Like, what does that mean? I'm not the type to want to commit suicide. That's just not in my DNA. But I'm thinking about somewhere else, which isn't here.
At the age of around about 12, 13, I started to contemplate suicide.
My name is Daniel Oliver Toby. I'm 28 and I battle with depression.
I grew up in a family that very much loved me. Brothers and sisters who were amazing. But there was always this elephant in the room, and that was basically the colour of my skin. So I have something called albinism, which basically means that you're born with a lack of pigment. And growing up, while my parents loved me dearly, it was never explained to me what was going on here. And so from a very age of around about like 9 to 10, I was always stuck with hearing people say certain things about my complexion, look at me in a certain way, question whether I was normal or not. You know, I'd have times walking to primary school and I'd have people on a bus laughing, ridiculing me. And I'm there thinking, why? Aren't I like you? Aren't I like, you know, everyone else around me? Again, I had no knowledge. But what it started to do is it started to create this wall, and it started to make massive insecurities for me. So I didn't trust compliments. I didn't trust achievements. I didn't trust any of that, because for most of my life, far into my teenage years, everything had been about you're an anomaly, you're different, you know, you're the ugly duckling, you're the abnormal one. And, you know, most of the time when you're jousting and gisting with like your boys or people around you, you laugh because you think to yourself, oh yeah, they you know, I'm cool with them and blah, 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 and you laugh. But when you go home, something starts to click. And you start to realize the jokes ain't funny anymore. So at the age of around about 12, 13, I started to contemplate suicide. Thankfully, it wasn't a lot at that age, and the community I was in meant I was distracted a lot. But I do remember there was a particular time where I really contemplated just kind of ending it all.
My name is Susan Lamina. I struggled with postnatal depression, and I still struggle with anxiety. What happened was I had my children after being told I would never be able to have children naturally. I got married in 2008, loved my husband, and as a Christian, did the right thing, didn't even kiss my husband until we got married. So for me, it was like, we ticked all the boxes, God's gonna be great, I'm gonna have this baby on my honeymoon, I'm gonna get pregnant on my honeymoon, not actually have the baby, but I'm gonna get pregnant on my honeymoon and come back and life is gonna be sweet. Yeah, days will be bad sometimes, but life's gonna be sweet. And then I was having pain. I'd been having pain for ages, stomach pain, just thought, that's just life, that's women. But we're trying to get pregnant, nothing happened. Year after year, and as a Christian, you're like, yeah, I'm gonna believe God, but at the same time, there's this weird faith where you're like, I believe in this great big God, but this great big God is not doing great big things for me right now. This Christian formula that I've got planned is just not working. And I remember just thinking, we're just not gonna get pregnant. It's just not gonna happen. I went for diagnosis after diagnosis. The first one said I had fibroids. And then the next diagnosis was that I had polycystic ovaries. And every time the next diagnosis came, I could feel myself sinking a little bit, but I thought, you know, I've got to be strong. That's what we do. We've got to be strong. I then had an investigative laparoscopy to find out what was actually happening with me. and they found that both my tubes were blocked and that it would be nigh enough impossible for me to get pregnant naturally. So both of them had to be removed, which meant that I was sterile. And at my age, at that time, I was in my early 20s, to be told that it's life-changing. And I know that my family really struggled. But at the time, nobody allowed me to grieve. I felt suffocated, but not allowed to grieve for this fact that getting pregnant was going to be a hard journey.
It got to around about 2011, and my dad had passed away. I went into a deep bout of depression. I now grew up missing my dad, and the thoughts of suicide started to kind of return. I spent a lot of time traveling to work, standing on an underground station, and being at the point where I'm just like, jump. It literally felt like there was a cloud of darkness over my life, and no matter how many good things I had done or how many good things had happened to me, I couldn't get rid of it.
That eventually, we went through IVF, and it was really, really hard. It was a long, long process. It's very emotionally, mentally draining. We got pregnant, we had my son, everything was great. But after having given birth, I thought that, you're supposed to, in the movies, they say that, not just movies, I think everybody says, you're supposed to have a baby and there's going to be this magical moment. You're going to look in your baby's eyes and it's just going to be goo goo gaga, and clouds of hearts are going to float around you, and stars and birds are going to sing, and none of that happened for me. I just felt numb, absolutely nothing. I knew that was a baby. I knew that my son belonged to me, but numb. There was none of this goo goo gaga. As the months went on, I noticed, I think when he was a few weeks old, when I was breastfeeding him, I would feel immense depression. Like I felt like a dark, horrible cloud would just sit on my head, just literally sit on my head. And whilst I was breastfeeding, the worst thoughts would come to me. I would feel like every evil thought in my head would come, and I'm staring at this baby, but all the things that I could think were it was just horror.
I had, two beautiful kids, and when I had my daughter, it was great. I was really, really happy. But when I had my son, something really turned. It was almost as if the birth of my son made me more sad. But when my son was born, especially given his circumstances, I fell into this deep, deep place where I honestly don't know how I'm still alive today.
I had quite a traumatic birth with my daughter. Both my children were emergency C-sections. It meant that whilst I was in labour, both their heart rates would drop, and there were lots of complications, so I would always have an emergency C-section. So I had emergency C-section. I've got a son who's a toddler. He was probably 18 months old. I've had this baby, and a couple of days after the baby, I had my daughter, I started bleeding, and from the incision where the C-section. So there was complications with that, and they had to leave me left open, which is not the best thing in the world. So I say all of that to paint the picture that I'm at home trying to recover from having a baby. I have an 18-month-old son who's also trying to potty train, and I'm carrying this baby. So there's all this emotions going on. But did I stop? No, I just kept going. I was feeling low, but I just kept going. I knew in my body I wasn't right, but I just kept going.
So I remember sitting in front of my brother and my partner who I was with at the time, and breaking down crying because my family had never said to them or never spoken to them about mental health. Why? I don't know. My family, I could talk to them about anything, but that for me was something that I felt like I had to hide because I was always the strong one. I was always the funny one. I was always the one who lit up the room. And so it made sense that I can't tell you I'm sad because you're just going to be like, you know, I couldn't tell people that I think about killing myself regularly. I couldn't tell you that regardless of the fact that I love my kids with everything within me, sometimes they're not enough to keep here. I couldn't tell people that. And I couldn't tell people who are dependent on me within a church setting that, yo, this believing in God thing is not stopping me from feeling the way that I feel.
A few months later, I'd been signed off with stress. Come Father's Day 2016, I snapped. I remember standing in the kitchen, and I heard a pop in my head and a flood of the worst words I've ever heard me say to myself. And it felt like heat on my head, and I could not speak. I could just hear these voices over and over and over and over in my head. It was just loud, and my husband was trying to speak to me, but I couldn't communicate with him because all I could hear was these voices, and all I could say to him was, make it stop, please, just make it stop. Just put a bullet through my brain, like just shoot me, it needs to stop. For the life of being, I could see him, couldn't connect with him.
So I sat down, I was with my brother and my partner at the time, and broke down in tears, and I was like, I just need to get help. I went to my GP, and I was diagnosed with depression. And I ended up going through a good few months of just therapy. And it was very hard for me because I had to face me. And I remember my therapist saying to me, especially during the last few sessions, she said, you don't like talking about your emotions. And I hate it. I feel as though not only will people not understand, but I feel as though people get tired of it because it doesn't change. If you ask me tomorrow how I'm feeling, I'll tell you, I'm sad. Why are you sad? I don't know. And it can be very exhausting.
That meltdown was the beginning of me unpicking. What has gone on from there every year since has been me unpicking and unpacking and realizing what is going on with me and how I process things, and realizing now, I mean, it was just this year that I was diagnosed with having general anxiety disorder, and that's where I just live or have been living in a state of anxiety my whole life. I'm just on edge, but because I come across quite confident and I have, I was teaching for over 8 years and I had all this presence, people just assumed that, well, I tricked myself into assuming as well that everything was cool. But how my mind works underneath all of that is not great. Like, it really isn't. And it only takes me unpacking it all to realize where I am and what is really going on with me.
And so as I went through therapy and I started to discover a lot about myself, it made a difference. It saved my life. It stopped me from single-handedly taking my own life. But the journey and the battle doesn't stop there. And that's what I have to face every single day.
If you're a black person in this country, it's like 3%, I think, of us. So that's like less than 2 million of us. You're already deviating from the group norm, which is white. So if you now present with the same mental health symptoms as a white person, one, you're black, so you deviate just because of the color of your skin. So there's already that skepticism, that questionable, who is this person, what is this person?
in general, white authorities are not always the most trusted bodies that black people might feel comfortable going to and sharing intimate details about themselves. And I feel like that has a historical basis to it as well. You have a system that's not really well adjusted to people from these backgrounds. Then you have people from these backgrounds that are also quite insular and mistrust and not very trusting of the system. So there is, you know, I guess stigmas to break on both sides.
I think that our health system does tend towards relying on stereotypes, on racial stereotypes, and misjudgment based on kind of a lack of cultural knowledge, a lack of cultural understanding.
The perception that has been put out there of the black man, such perceptions are deeply rooted within systematic racism.
Let's assume a young male, white male of about 18 years old, behaving a bit bizarrely. We will say, oh, he's having an awkward moment. And then here you have on the same street corner, a black male of about 19 years old, behaving bizarrely, or straight away, he's on drugs, or he's having a diagnosis of schizophrenia. Say. So these labels are given without any contact, having no knowledge about what's happening, but we are quick to make these judgments upon people without even understanding what they're enduring.
My counsellor, I went to see once a week, and it was in school time. And she was very good at trying to get to the bottom of the truth, why I was doing what I was doing. One of the questions was to do with what I do at home and how my parents reacted to what I was going through. So because of your ethnic background, it must have been hard for you to tell your parents. And in that instance, I'm thinking, what do you know about my ethnic background? How do you know that it's hard for me to speak to my parents?
You can't see me, you can just see what you want to see. Again, they choose to kind of engage with you on certain levels, and I think it is subconscious. I think people are sat there being like, she's black and therefore she must do it, but something is telling them, white supremacy is telling them that I should be acting a certain way. If I'm not acting that way, something's wrong.
It's not just about race. And I think that question threw me off, because if she can ask something like that, then she's already painted a picture in her head of what my life is like at home and what my family is like and how they don't support me. And then she's gonna write up all these notes, and it's gonna look like my parents have a part to play in how I'm feeling. And that made me angry, to the point where I didn't want to go to my sessions.
I think that race definitely affects the way that you receive care in the NHS, and I think it's the same in all institutions, to be honest. Sometimes there is a perception of more physical strength in black people, and I've seen it in the way that you might see a black patient restrained versus the way a white patient might be restrained.
I realised they're seeing something that's not there, or they're seeing something that they're seeing a racial stereotype, is when I tried to escape the hospital. I tried to kind of open a door and run away, and I was just trying to go home. I wasn't going to hurt anybody, and it was very uncomfortable, like realization when they were viewing me as not even just a black woman, but even like a black. I'm 6'1", so the physicality they saw approaching them was physicality they saw kind of standing in the room, asking to let out was like I was like. It heaped masculinity on me, black masculinity specifically, which is completely demonized by white society, by kind of all society. And I think that I was completely vulnerable to the care of the state. It was my first kind of illumination that the state doesn't know who I am, doesn't care to know who I am, doesn't see me for who I am. It sees me as a set of behaviours, and they have a set response to that, which is kind of very scary.
There's this thing where, you know, as a woman, you're supposed to look after everybody and, you know, you're supposed to keep the house in order, and because of the dynamics sometimes, you know, you end up providing and nurturing and doing everything at once.
From an early age, the girl is taught to take care of everything, basically. You know how to manage a household.
It was like you were supposed to do as many things as possible, right? So you are, in our household, there were no boys, right? So we had to clean, cook, paint, fix, repair the washing machine. We did everything.
I felt like I needed to, as the eldest woman in the house following her. So feeling like I need to look after my little siblings or even my older brothers, checking everyone's okay, getting stuff for the house, like that. The responsibility of keeping the house in check just naturally fell into my lap. And even though it wasn't directly said to me, I just felt like I needed to do it. And then again, that just adds on to the load that I'm already not carrying well.
I thought that's what you're supposed to do as a wife. You're supposed to go out and work, but still come home and make sure the house was beautiful and make sure your husband is fed with all these amazing delicacies, which I did not care too much to cook for, but I did anyway, because I guess I just thought that's what we do. Nobody wants to be seen or perceived as weak, and least of me, having this long history of a grandma who has literally raised 4 children by herself after her husband died when she was 40, and then my mum going on to raise us 4 girls by herself after my dad left. And there's this thing in society, especially amongst black people, as being a black, strong woman.
Whether you like it or not, what we're told we're supposed to be has a huge effect on how we are. If someone tells you that you always need to be strong and then you don't feel strong, not only do you not feel strong, but you feel like you're not doing what you should be doing.
The strong black woman has affected me. So people assuming that it's impossible for me to feel sad or feel any type of way that isn't kind of serving them.
And so for me, strength was about carrying on. Whatever happens, you carry on. So your dad leaves, you carry on. So maybe you get raped, you carry on.
So we kind of just trod through like a mule, just like the world on our shoulders, not feeling like we can ever stop because we've got so many people that are relying on us or people that we need to support, or just the fact that we don't feel we're able to, you know, show weakness or to be down.
When you are a black man, oftenly and stereotypically, there isn't much room for maneuvering within your identity. You have to be one of few things, because that's what society has told us who we are, and that's what we play up to. There's always this level of expectancy. There's always the notion that, you know what I mean? You gotta hold your own, you gotta be. That's the expectancy, that's the notion. That's the ideal. You gotta be with it, you gotta be tough. You know, this is the cultural norm, this is what we all adhere to, you can't waver.
To some extent, boys don't actually verbalize much anyways. They're more action-orientated.
Black men would not openly, in my experience, would not openly come out and talk about their mental health problems. It's around their idea of being strong, pulling their socks up, and just getting on with life.
Guys can talk about anything but that. And it's so strange because as soon as you then start to admit to someone that you're weak or there's an issue or there's a problem, you start to think that the other person sees less of you. And I think that's always a common problem with men, because our outlook and how we're perceived is so important to us.
From what I've observed in black men, there's an assumption of strength. And this is strength on all corners, just complete resilience, like impenetrable resilience. They can take on anything, you know, as long as they have something to eat and, you know, a bit of money in their pocket, they're all good. And that brings a lot of shame when they're not all good. It makes it very difficult for them to admit that they're not all good.
We have a pride dispensation. We don't really like help. We very rarely like opening up like that. So very rarely do we ever want to be in a position where someone opposite of looking at us, we don't want them to see, yo, this brother's weak, or he has weaknesses.
You know, I was raised by a mother and, you know, 2 older sisters that I'm very close to. So I was raised predominantly by women. So probably some of those feminine traits have seeped into my character. But that doesn't make me less of a man. However, I would be perceived as less of a man by my other, you know, by the other men that are around me that are black.
At some point, you've got to look at yourself as a man and be like, what's really going on? And I guess one of the biggest stigmas about that was about being emotionally available, particularly when it comes to like letting out your emotions and crying and speaking. And I guess for me growing up personally, yeah, I was a teary guy, but I wasn't. I hate the fact that I had to cry in public a few times annoyed the life out of me. You know, the passing of my dad, the circumstances around the birth of my son, and you know, other moments when I was growing up, I could be teary, but by myself, yeah. And it started to become apparent as time went on, especially within the past couple of years, because my emotions were very much, they were locked in, they were very apathetic, very like, it was almost like I felt a little bit like stone. And then if I even pondered the thought of crying, I just felt like, what's wrong with me? And I know at this point, I'm heavily battling depression, heavily battling suicide, heavily battling, you know, just a lot of deep sadness. But I'm like crying, like, what are you doing?
Being a man, being a black man, why do we feel lesser than if we shed a tear? Why is it that whenever the narrative or the conversation is about being a black man, it's always about being strong, being bold and being brave and being alpha? And this, you know, this word that's always thrown out these days is, I am a king. And whenever we, you know, refer to ourselves as that king, it's always these attributes of strength and boldness and power. But we never talk about the other attributes that we should inhabit and practice, which is sensitivity, softness, empathy. We don't talk about that.
Postnatal depression is a condition where people that have just had children are essentially depressed. That might be due to a lack of connection with the baby. It could be hormonal. It could be just the actual recovery period of having the child. But they're not as active as they once were. It's a massive life-changing event having a baby, especially going through the physical trauma of having a baby. So it can leave the lady feeling very deflated and not very active, not very motivated, even in some cases suicidal, not very connected and feeling guilty that she doesn't feel connected to the baby, feeling very pressured, especially with you know, all sorts of visitors coming in, having to smile and keep the house clean, and all these things become a lot more pressuring and burdensome after the event of having a baby.
Other women were kind of judgy, so if I said I was feeling a bit, you know, I really just didn't want to be around my kids, a mum would look at me as if like, didn't you like your children? Especially if they didn't, if they knew my journey. So if they knew that I had to have IVF and I'd had this challenge with my fertility, opening up and saying to them, oh, by the way, I really don't like my kids, or I don't really want to be around my children, or I'd like some more sleep, it was like you just don't say things like that. People would correct you or tell you off or shut you down or push you away.
There's still the assumption that they're still supposed to get on as though nothing happened. And I feel like that is a real hindrance for black women.
How could I explain to my husband or to anybody else that this miracle child that I've had, this literal miracle that I'm carrying in my hand, is now making me feel mentally not well?
There's the assumed belief that we should be grateful, and that's supposed to cover any issues that we may have. So in the case of postnatal depression, you should be grateful you had a baby, and that's as a way to kind of overlook the fact that even though you had a baby, you're still struggling, or, why do you feel depressed? You should be grateful you have a job. Why are you depressed? You should be grateful you woke up this morning, which these are not bad things. You should be grateful for these things, but they don't kind of remove the facts that this person is struggling with a certain issue.
And when you're saying those kind of things to you can't say those things. There's no room to say those things. There's no safe space to say those things because there's just so much judgment.
So I guess this whole idea that when you see a black woman who, appears to be fine and, she can still laugh and, she can, on the outside, it looks like she's fine. But the fact that they're telling you they're not isn't enough, because the sight of them is like, oh, they're fine, they're okay, they can manage it.
So much is about making sure that everybody else is okay, and that's what gets you through, because that's your role as a woman, that's what you're taught to kind of represent, is kind of stability, unity, and for your family unit. And I think that there's not the space to be vulnerable.
And there's this long list of things you're supposed to be in. The minute you don't do those things, it's like you're disregarded. It's like you're lower down in the pecking order. It's like you're less than. And no one wants to be shunned. No one wants to be lonely. No one wants to be the one who is different. No one wants to stick out. I didn't want to be lonely. I didn't want to stick out. I wanted to be accepted. I wanted to be perceived as strong.
So I am of Nigerian descent, and mental health amongst Nigerians, let alone Africans, is a vortex, for lack of a better word, because in an African home, it was almost a shame if you had mental health issues.
They think whatever you're experiencing, by they I mean the older, our parents, uncles, aunties, they sort of disregard whatever you're experiencing, or they minimize it. I don't think they even acknowledge that it exists, or they don't understand it, or they think it's due to a spirit. To some degree, I can understand them, because for the majority of our parents, or the older folk, they got on a plane here, they had nothing, and then they built themselves up. So I can understand why they come to that conclusion, because generally speaking, to even achieve that, you need to be very resilient to go to another country and build yourself up from the ground up. So when they hear like their children saying, I'm dealing with X, Y, and Z, they'd be like, what is this that you're talking about? Does it really exist, type thing? Or at least there's some skepticism on their part.
We didn't talk about mental health in my home, beyond like, you should be happy. We want you to be happy, but not kind of further than that. How do we be happy? Are you sad, and why are you sad? Or there's that next step that you have to take. And I remember going to visit my sister at university and not wanting to go out and meet her friends, not wanting to really do anything. I wanted to stay in the house and just kind of chill with her. And she was like, ugh, like, what's wrong with you? Are you depressed? Only fucking depressed people do that. And I was like, well, like, yeah. Clearly I can't talk about it with you because that's something that is so impossible, so alien to my sister, let alone somebody who I don't have an intimate relationship with.
Because of the culture that we have, we never expected to grow up and experience any form of mental illness. And then when we do, we don't know how to handle it. All these emotions are rushing through us and we can't contain them.
Living in the West and having immigrant parents, and us being the generation of black people who have everything, who have not suffered like our parents suffered, our grandparents suffered, and so there's kind of a focus on surviving and not thriving. We're trying to thrive and our parents are trying to survive. And so there's like a, intergenerational disconnect, I think. So people, they see us, not being able to leave our beds and we're just lazy. They see us not wanting to engage and we're spoiled, not wanting to engage in family activities, whatever. And we're being too Western, and I think that that really impacts how you kind of see yourself.
Even in my personal life, I, being born in the Caribbean and growing up in the Caribbean, it's almost like I have to be strong. I cannot be seen as weak, even when I'm not feeling great that day, or feeling positive about life, or feeling excited about what's happening. I might be sad, but I was told that I just have to be brave, don't cry, and just get on with it. And coming over to the United Kingdom and being a nurse practitioner, I have seen this forehand where parents would expect their young children to be strong and to move on, regardless of how they're feeling or how they're felt, based on a situation. It could be feeling depressed or feeling anxious about exams, or anxious about a job interview, or extremely anxious about a situation, and it just gets prolonged and prolonged. I have seen how this affects further sort of experiences.
I'm my mum's oldest daughter, so there's this responsibility for elder siblings to kind of be upstanding and to set an example for the younger ones, and to, from the minute you're earning, you need to be financially supportive, you need to be emotionally supportive, you need to be present in the house. So yeah, from a young age, you're already embedded with these responsibilities, and you're growing into an adult as early as you can. So I feel like that I didn't really feel like I could, stay sad, or, when I was sad, I'm thinking, well, shit, I need to get stuff done. I can't not succeed. I can't not make it, because I've got, I need to make my mum proud, and I need to, support her so that when she's older, I can look after her. So I don't have time to be unwell. There's no time for that, because I need to provide and I need to give back. So all of that pressure is running through my mind while I'm also trying to juggle uni, and I'm trying to work, and I'm just trying to get out of bed.
So there is that sort of air of, I have literally killed myself to be here, and the small 6 modules at university is killing you.
But I guess when you're not supported, that pressure becomes detrimental rather than supportive. Rather than it driving you on, the pressure just weighs you down. So I think we need to find the balance between retaining our culture, but also supporting ourselves to sustain it.
If I turn around to somebody, oh, by the way, I'm having anxiety attacks, they'd either accuse me of being too white, of knowing too much whiteness. That's why. That's why I'm giving myself this title.
Because of how much they've experienced, they don't necessarily think what you're experiencing is real or should even negatively affect you, because they've gone through X amount of issues, and then now they see their child and it's like, this is minuscule. And the reason they say it's minuscule is because they compare it to what they've experienced.
How do you tell them how you're feeling? How do you express how you're feeling? How do you even begin to describe? It's just, it was scary. That is the word. When my mum found out, I thought I was going to get beat. At that point, I didn't even worry about my depression or anything like that. It was just about how she was going to react to how I was feeling. I was scared.
Prior to that, yeah, you've seen love. They love you, they clothe you, they feed you. Maybe they do have conversations with you, but particularly about your mental health, from me growing up, it's rare. I don't think I knew anyone who had parents who would speak to them about something like that. Definitely not anyone in my vicinity anyway.
So most young black people in the UK are, I guess, 2nd, 3rd generations. So from the previous generations, I guess there was a bit less time to even be so introspective and, I guess assess how you're feeling. And should I seek help, should I not, because it was just about survival.
I struggle with being vulnerable because I don't think it's something I've grown up understanding. You know, when you're crying, you're being told, I'll give you something to cry about. Like, you're not trying to catch nothing for shedding unnecessary tears. So the concept of like crying and being sad it's not necessarily encouraged.
Because culture for a lot of the time has probably stopped us from doing such a thing because of shame, because of embarrassment, because we feel that we're strong, African, we're proud. We don't show such weakness to people outside. But that's the problem. And then when it all falls down, you start to realize that this very thing that we've held onto, this pride, this arrogance, has actually been our downfall.
While it's amazing to have resilience, that we have a lot of historical basis to call ourselves a resilient people, but then we also have a lot of shame when it comes to admitting weaknesses.
When my cousin committed suicide, that was a huge, huge, huge thing because, as I said, my cousin, he had a job, he had graduated from university, he had a loving girlfriend, and his life was perceived to be perfect, as my parents and aunties would say. So they couldn't fathom, they couldn't understand how he got to that stage of wanting to not be here anymore.
I feel like the culture of having a lot of strength can make us want to take on even more than we can. So I think that shame, when it comes to admitting, you know what, I might be weak, I might have this illness, stops a lot of people. It makes us cover it up a lot. And I feel like that's why it gets to a really late stage before we decide, do you know what, this is beyond what I can manage anymore, I might need help, which shouldn't be the case. People should, with anything, the earlier you seek help, the easier it is to overcome. And that's just the logic of most illnesses in general.
It was as if my cousin had been killed. Like, they didn't react to it as if it was suicide, as if he took his own life. It was, that sorrow was there as if someone had murdered him. God, why have you taken him from me?
Religion in one aspect is quite helpful because you have a community and also you have this trust in a higher being that's there to protect you no matter what. But there's also that wonderful support network of being part of a religion as well. That sense of community, that sense of support.
Throughout my senior years in school and college, I found it hard to connect with God because there was so much going on in my life. And I didn't necessarily blame him, but I asked, why me? Why was I going through stuff and no one else was? And so I stayed away.
I believed in this great big God, and I still do. I still have my faith. I'm still for want of a label, a Christian, right? But I felt that there was a lot of resistance to saying the words anxiety or depression.
Within religion, again, people don't really talk about mental health. They would more relate it as a faith issue rather than a mental health problem. It still remains, by and large, a subject area where it's not really preached or discussed from platforms.
So there are things and challenges that are acceptable. So if perhaps you've got a challenge financially, that's acceptable to describe or to discuss. If you have a challenge perhaps with an in-law or a friend, that's acceptable to discuss. But things about, actually, I'm annoyed with God because I should have been given a child by now and he hasn't, That's not acceptable. And if you do choose to discuss these things, you must describe them in so-so ways by saying, I'm believing God for the fruit of the womb, or I'm believing God to give me a child. You're not allowed to say, actually, no, seriously, I'm annoyed with God. I'm actually angry. I'm disappointed. I'm upset. I'm really pissed off. Like, you're not allowed to say those things.
To be totally honest with you, I was so afraid to speak about suicide, anxiety, not wanting to be here, even the thought of depression. One, because I wasn't really and truly sure, but two, I was so afraid of what people would say or how I'd be judged or how I'd be ridiculed.
I wasn't allowed to express my opinion. My feelings was not allowed. It wasn't palatable to them.
Living in a society where you're a minority, having, I guess, a hub to go to where you see faces like you with similar beliefs, it's already a therapeutic place to be in.
So when I told my youth pastor about the depression, the anxiety, and also what had happened to me, it's as if he knew the answer to what I was telling him. And so at that point, you know, I got my hopes up thinking, you know, there was going to be something that was resolved. And then he told me that it was basically all in my head. And depression and anxiety is all of the devil's work. He asked me to forgive that person because for my own salvation, because if I was to forgive him, then of course God would forgive me for anything that I had done.
I remember when I went to see the leadership of the church to talk about the fact that I'd been told that my tubes were blocked and they'd have to be removed. And all I said was, I feel like this is all my fault. I feel sad. And instantly, I was told, that's the devil. Don't let the devil speak that to you. And it was as though I was like those ballerinas, you know, in the jewelry box, and they're turning around. And then I was spinning and I was trying to talk, like, my emotions through. And the minute that he reacted in that way, it was like the box was just closed and that song wasn't being played anymore. And I had to almost recoil into myself. I just had to, you know, make it less, push it down, suppress it. But I was feeling all this emotion, waves of huge emotion, waves of depression, waves of anxiety, waves of anger, waves of all sorts of emotions I couldn't really actually understand. It was just met with a lot of dismissal, a lot of anger, disappointment. I was told to grow a backbone, pray more. That was a big one. Pray more. You're not praying hard enough. Pray more.
Number one, you're actually undermining my living experience, because actually I feel this way because life has been quite hard, and that's the way my body and my brain is dealing with it. So you're undermining all of that and jump into an external factor. And then it also doesn't provide much space for improvement or healing, because if you're just saying, oh, it's spiritual, oh, it's an attack, so what do? Just sit and pray? And then what? Like, it's very reductionist and it doesn't actually give you much power to do anything. And I believe that you can pray, but I also believe that you should do things here to also benefit and to improve. So I feel like that dismissal of my experience, it was so detrimental and invalidating to kind of hear that what I'm going through is just a matter for it's outside of our sphere. It's not even something that we can actually take ownership of or, you know, make a difference to. It's out of our control.
Religion can definitely cause complacency in terms of help seeking. Some people use, you know, God and the church as a reason to not seek help from outside of that setting, which, as a Christian myself, I don't believe that that's necessarily encouraged. I believe that there's all sorts of resources and you are supposed to access them, and you can simultaneously pray and have support from the church while doing that. But I feel like there's kind of a culture of, you know, only trust in the church, and anything from outside of that isn't necessarily needed.
I'm going through what I'm going through, but I'm hearing from, you know, in the pulpit or even people I'm talking to, oh yeah, you know, you don't have to be depressed. What are you depressed for? Look at what Jesus has done. You know, you've got faith, you've got all of this, blah, 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 blah. And for the first, you know, especially when you enter in it for the first time, it's great. Eventually you keep hearing that, but your problems, like your life isn't changing, you're going down a deeper hole. I think what a massive stigma is, especially around mental health and therapy, is that if you go down that route, something's either wrong with you or you're so weak that actually maybe really your faith is in question or what you believe in is in question. Actually, no, it's not.
I never dared say to anybody I was taking antidepressants, and other people said that antidepressants were happy pills. They're just going to make you happy. You're not trusting God enough. That's one I got that really annoyed me. I wasn't trusting God enough because I was taking antidepressants. And already I had enough guilt and shame about taking the antidepressants. I've done enough to my body. I've gone through childbirth. I've had, I think, 5 surgeries. I know what damage I feel that I have done to my own body to now go and take antidepressants on top of that. I was already worried for myself. Talk less of you sitting there telling me that I am weak because I'm taking antidepressants. When I realized that actually these emotions are real and it's fine for me to express them, it was too late. I'd already suffered the mental meltdown.
The community do think that you can either go through the community, church, whatever that might be, route, or the clinical route. And I feel like it's very important that these two things kind of meet somewhere in the middle. You're not betraying God or your religious institution if you decide to go this way. And I feel like it hasn't all the way clicked that if you're having a problem with the mind, it can be as severe, if not more, than a physical problem. So I feel like our general recognition of these problems aren't as a medical problem. So it's not like an outright defiance that this person has a mental health problem, but we're not going to get them mental health help. It's just not registered that this problem that this person is having is a true mental health problem. So we just need to, I guess, increase the levels of awareness and education, because I do feel like there is mental health knowledge in our communities, but just not in the way that it is in a Western sense. And I guess we kind of just need to catch up because the resources that are available to us are Western resources.
In terms of the Black community, I think that there are quite a few ways in which we can destigmatise the stigma of mental health. I think that number one is about communication and starting the conversation. I think it's starting, but I think it needs to be kind of intergenerational. We need to be listening to our parents and their experiences, and that we need to be providing services for them to be able to access support for them, because it's so normalised for that generation. It's so like pain and suffering is so normalised in the Black community, particularly for our elders, that they don't see it as an issue. That's part of life. We're all going to be sad. We're all going to be All we have to do is get on with it, and that's the mindset that we need to change. And we need to support wanting more for ourselves in terms of happiness rather than stability, or happiness rather than security.
Try to make myself feel uncomfortable in ways that are helpful. So, you know, I've gone on like six-day retreats where there's no talking. So yeah, it's a silent retreat, and there's a hell of a lot of meditation and, you know, vegan food and all that jazz. But yeah, stuff like that where I was completely uncomfortable, like no phone, no social media. It's just you, yourself, in the middle of nature with a bunch of strangers that you can't talk to. So yeah, little things like that to take me outside of the box I'm in and remind me that, you know, I can do whatever I want. You know, I've got options and choices, and I think that's sometimes what I would lose, that I would feel so like locked in, that I would feel like there's nothing there for me. But I've had to go out of my way to look for it.
As my thoughts as a community on how we can raise awareness to better support not just the men, women in the community with mental health problems is to be open, have open discussions. Why we're looking at us, because we're least likely still to this day to seek help on time. So it's making it a discussion from childhood.
One day, by God's almighty grace, my 10 to 20 year plan is to build my own school for kids in care and special education needs. And I'm currently working towards that. As I said before, I have another business. I am a network marketer. I currently trade foreign exchange, and in doing so, I'm saving up to then work towards building the school. And right now, it's all about gaining the experience and the knowledge so that when I build the school, it will be the best in the UK, so that I can help every single child, no matter their situation.
So right now, I'm doing a lot better. I'm in a great space. I feel like I have life in my body again, and I have purpose. The thing that was missing was purpose and direction, and I have that now. And I found my purpose and direction by tapping into my own creativity again, you know? And I think the loss of my mother and the journey has all gone kind of full circle, and that purpose has now been reinstalled, and I feel great. Currently now working on my own documentary series that I wrote and produced myself, and I'm even presenting it too, and that's going great. It's taken me to Israel, and it's about spiritualism and finding your individual pathway to God. So that is also part of my healing, is through that project.
One thing that I do with my platform, Lafia Health, I specifically go to churches, because I know that's like a massive cultural hub for a lot of Black people. And I know that is where a lot of Black people go if they're having these problems. We just give a bit of education and background knowledge on mental health, what it is, common mental health problems, so that people can recognise what these things are, that it's not just a bunch of feelings, it's not just a bunch of random symptoms or instances. It actually has a name and it has a way to be treated. I think it's really effective when I pick out these key people in the Bible and say, actually, these people wanted to kill themselves. These people were very low. This person had this problem. This person self-harmed. And it opens their eyes a lot that it's a reality and it can affect anyone around them.
So where I am now mentally, I haven't reached by any stretch of the imagination. I still battle daily with depression. I still do honestly battle with suicide. But I feel like I'm in a much better place, in particular amongst the people that are around me. I'm, even from a personal point of view, like, job's going great. I work for like a pretty big hospital in central London. I've been doing photography, videography, video editing from a freelance perspective, and I've got the privilege to shoot for LMA, Better Bond, kind of list goes on. Even more opportunities kind of coming this year that I can't even reveal, which is just amazing.
I love my son, I really do love my son. But I love my daughter too. And every time I run to her and we embrace, it's almost like God has given me back my childhood. Like, I know she's not me, but she's me at the same time. And it's a new chance, it's a new opportunity.
So I would urge people to become educated around mental health and the services that's available. I urge people to become, not clued up, but more aware of treatments that's there for anyone who suffers with a mental health problem. And mainly those who are of the African Caribbean background to step out and to say, I need the help, I need the services, I need the care and support, rather than to suffer in silence and to neglect the opportunity to get the right help at the right time.